Welcome back to News Watch 12 this morning, and we're going to be joined by Providence's Kristen Filer. So research is saying that cervical cancer is on the rise. How do we go about preventing it?
Well, the number one way that women can prevent cervical cancer is through a pap smear. This is the number one way to detect whether or not you have abnormal cervical cells. So they have saying that 47% increase in white women with cervical cancer, 72% in African Americans increase in cervical cancer. So we're really trying to make sure that women realize that a pap smear is the number one way to help prevent. Now, a pap smear, first things first, it doesn't necessarily detect cancer, it detects abnormal cells. So, and they recommend that you do it. Now, this is kind of where the research gets a little controversy, but depending on what your personal doctor recommends, it is anywhere between 1 and 3 years, at least every 3 years, starting at the age of 21 or within 3 years of starting to have intercourse, but definitely at 21, all the way up to 65. And then after 65, that kind of is up to your doctor and your health history as to have the previous pap smears been abnormal or normal. So that's all going to depend once you hit 65. But for our 20s, our 30s, our 40s, our 50s, we absolutely need to be getting a pap smear every 1 to 3 years. If you have an abnormal pap smear and that comes back abnormal, you're most likely going to have one every year. Now, I like to tell people that an abnormal pap smear doesn't mean you have cancer. It means abnormal cells were detected, and now your doctor is going to do a new line of testing, usually a colposcopy or a type of a biopsy to see, are they actual cancerous cells, are they precancerous cells, and then go along the lines of treatment. Just because you have an abnormal pap does not mean that you have cancer. It does not mean that you have to go and get a hysterectomy and you have to have chemo and radiation. It just means that you're going to start to be monitored more frequently. And there are ways of getting rid of those cells. You can freeze them, you can destroy them, you can go in and scrape them out. There's lots of ways of doing that. So pap smear is so important to be getting starting at the age of 21. And then making sure you get them every 1 to 3 years, depending on what your doctor is recommending.